welcome Madam Sharjit Kaur, Chairperson Director, Shahid Baba Deep Singh College of Nursing, all the faculty members and students. So we were in the limelight for many days that Delta Healthcare will be visiting our esteemed institution. So we have two of our Delta team member, that is Mr. Ash Sharma, that is the National and Sales Service Head Department of Delta, and there is Mr. Sahil Srivastava, that is Simulation Educator North. So North is looking by side of Delta. So both will be dealing and they will be telling about the product demonstration which we have been received in our college. They will be talking about some of the brief ideas of simulation lab, how we have to set up the simulation lab. Because as per the Indian nursing concept, this is mandatory module nowadays. Everybody knows all the curriculum has been changed, it has been the semester system, elective modules have been added in our curriculum. We have simulation labs nowadays set up in every college of nursing. So all the brief ideas will be given by our esteemed guests who have visited from Delta Healthcare. And without wasting much of the time, I welcome both Mr. Arsh and Sahil. So please take on the dais. Thank you very much. Thank you.
So, good morning everyone. Good morning, sir. So, I will be starting the short presentation with you for Delta Healthcare. So, like, what is Delta Healthcare and what about Delta Healthcare? So, Delta Healthcare is an organization building future-ready healthcare professionals. So, Delta Healthcare is a one-stop solution since 2010 for colleges, medical colleges, Ayurvedic, nursing. So we have more than 1500 range of products at Delta Healthcare, be it anatomy, simulation, every range of products. So our mission is to bridge the gap between theoretical learning and the real-world healthcare practices. So this is about Delta. So how our approach is, we have the partnerships with the healthcare institutions, dedicated faculty members, and student-centered learning and holistic development. So our reach is like we are present at 14 plus states currently, and we have 400 plus customers. In customer stickiness to us is 97%. With the products, it's not like that we give only the products and we forget. We give trainings to each and every person. So we, as like today we are here with my simulation team, so we will be not delivering only the products but also the training of the products, how they are used, how they are maintained. So each and everything will be given by Delta Healthcare. So you can see the wide range of products we have, like anatomy models, medical simulation, task trainers we have. So well-crafted products, we are currently working with the Indian Army also, that is a very well-proud field for us. So you can see the images like how we train the Indian Army for Delta Healthcare products. So we have, with the products, we have the passionate trainers who give excellent training, simulation training to all the faculties and nurses. As rightly mentioned, that currently, as per the INC norms, we have to have a simulation lab at each and every college. So our main focus is to provide the products and the services to each and every college across India. So these are the key lab setups we have done. So TNA, Greater Noida, if you have heard about TNA, so we have built an excellent simulation lab at TNA, which is powered by Delta Healthcare only. So over there we have placed all the high fidelity mannequins that are required for the trainings. So students from all over India come to TNA and attend the trainings and workshops over there. Our other key lab setup we have done at Parul University, Pragya Lab. If you all have heard about Parul University at Gujarat. So it's a very huge university. Over there also we have set up a simulation lab. So other key players like Dr. Patil, Pune, Navi Mumbai, we have done Udaipur, Bangalore, Chennai, Manipal. So these are the key lab setups we have already done. So thank you so much. So without wasting the time, I will give mic to Mr. Sahil. So he will give you the demonstration of the products and the simulation.
So First, we will discuss a little bit about simulation. So, do you guys any idea? Do you guys have any idea regarding simulation? What is simulation? Anyone? Yes, you can
Stand up
answer.
and tell.
Real life situation. Very good. Clap for her. So simulation basically means what happens usually when we enters to the first day of our clinical postings. Suppose if we are posted to the emergency area, and sometimes on the very first day we will encounter an RTA case. Then what was our state of mind? We got into panic because we are new to the area, new to the department, and we are not aware about anything. So we learn the many skills from basic to advanced in the labs. But again, when it comes to real life scenario, if we are having good clinical, good theoretical knowledge, but again, how to deal in an emergency situation is an important thing. Because how you will react to the situation will determine the chance of survival of the patient. That's why simulation was introduced in nursing in India, in medical or healthcare professional. So that we can create a realistic scenario for different disease conditions in our colleges only. Once you will face all these scenarios in detail, then when it goes to the clinical, you will have more confidence and you will feel competent enough to face that emergency. If you have encountered 5, 6, 7, 8 different scenarios, and I can say 10 to 15 common disease conditions that came in the emergency department, then you don't have to think that this is the next step we have to do. And if you have done the simulation practice or trainings, then you are aware that what is your next step. So this is how simulation works. Basically, we will create lab and we will make a realistic situation like real ICU beds, real ICU patients. We will create these mannequins as real ICU patients. You will listen to them. They will answer to your questions, everything like that. So for getting a more detail about how does a simulation labs look like, I'll show you two reference video, one from TNA and one from Pragya Gujarat, so that you will get more detail and more depth about simulation.
We are proud to introduce the TNAI's National Advanced Nursing Simulation Center, a premier facility now open at Greater Noida. With this launch, TNAI reinforces its commitment to nursing excellence and highest standards in healthcare. This dynamic center is designed to shape the future of nursing through innovative simulation techniques. When participants come to the center, they are guided to follow protocols that promote a clean and professional environment throughout the facility. The reception area provides a welcoming atmosphere where they can complete their registration and receive a brief orientation from the faculty. For developing skills competence, the center has allocated space to practice on task trainers with procedures like injections, airway management, catheterization, newborn resuscitation, and examination. This can be rearranged into a classroom for interactive sessions. The center features various simulation rooms focusing on critical care management, life-saving procedures, and intermediate care. These rooms feature realistic mannequins and equipment, fostering team-based learning and enhancing nurses' critical thinking and clinical skills for everyday practice. For reflective learning, each simulation room is connected to a debriefing hub. The faculty room offers the instructors a quiet, functional space. At the heart of this innovation is TNAI's Advanced Obstetric Simulation Lab. This pioneering lab transforms healthcare education and practice by offering simulation and hands-on training in emergency obstetric care and neonatal intensive care. Join us in shaping the future of nursing, where innovation meets excellence in education and practice.
So after seeing this video, you will get an idea what is simulation, and you have seen the entire video. It doesn't look like a traditional lab setup. It is the replica of the ward. We have created one ICU setup, we have created one emergency and one ward station. And we created exactly like we have in our hospitals. So that while practicing, student will not feel like we are in labs, we are with the mannequins. So there is no harm. Because in simulation, we also declare the mannequins dead as well. so that you will know the importance of life as well. That's why simulation can make big differences in the learnings and you can retain the things for long duration of time. Now I'll show you the next video that is for the another lab.
The Skills and Simulation Center is not just a laboratory or a center, but it's a concept and vision to impart and enhance the most crucial life-saving skills, procedural skills, diagnostic and critical decision-making skills to thousands of undergraduate and postgraduate medical, paramedical and nursing students. Ranging from the most advanced high-fidelity simulators to the very basic task trainers and mannequins, this center will provide an excellent hands-on pre-hospital exposure to health sciences students, interns, as well as practitioners.
Okay, so these two are about two different labs and this is how simulation works. Okay, so thank you. Now we will move with the product demonstration. Okay.